Yeah, good morning, everyone, and welcome to another session. It's really a very simple and relaxed program in which, from time to time, I try to bring out issues that we are seeing from parents who we're talking to. For those of you who may not know, we have a program every Thursday which we call Hangout, CP Thursday, where our parents individually host and share their experiences. I have also spent my time, sometimes over an hour, speaking to close to 2,000 parents now. And so I've also learned things apart from my own personal experience as being a CP father. My wife's experience as being a CP mother. But these things, I believe, put me in a unique position to share knowledge. Before starting proper with Benola, we committed ourselves, my wife and I, to doing an in-depth study of cerebral palsy. We traveled extensively. We went to India, we went to Germany, we went to Britain, and we went to I think it was Austria, and the last place we went to was United States for the American Association of Cerebral Palsy. At all these meetings, there were interesting discoveries, and I believe it is the reason why I try to share my experiences and try to explain to people that advocacy is very important. We need to bring out more parents, and we need to get more parents feeling comfortable about telling their stories. But in the past, close to 18 months now, I've noticed that many parents are now out there on social media, speaking, telling stories, and unfortunately, some of them are trying to be authorities on cerebral palsy without having done the proper homework. And what kids can do to parents whose children are in very poor states is confuse one, or even make you feel that, wow, if a lot of these children can walk, they can feed themselves, they can do so and so things, then something must be really wrong with my son or my child. And so by talking about many faces, which we're going to do today, is to let you know that no two faces are alike, no two CP cases are alike. The people with autism a long time ago, they coined the phrase the spectrum, autism spectrum, but which means many colors, right? But in actual sense, disability, whether it's cerebral palsy, autism, Down syndrome, etc., even if you talk about amputee, it's many phases. It's whether it is the whole leg is gone or part of the leg or so on and so forth. And it's about helping the individual to adjust, to accept their situation, and then go on from there. So without wasting time, I'm going to start off with the lecture program. Cerebral palsy, I think we'll just talk a little bit just for us to refresh our minds and understand. It's a group of disorders of the development of movement and posture causing activity limitations that are attributed to non-progressive disturbances that occurred in the development or the infant brain. In development here, it's talking about why the child is in the womb, and the infant brain is where the child is below the age of 5. The prevalence, in the developed world, they keep good records, and apart from that, they have very good medical services. So the prevalence is about 4 to 1,000 in the UK, 2 to 1,000 in the UK and so on. But in developing countries like Nigeria, it's a lot higher. Our records, based on some research done by a few Nigerians as far as recently as 2011, shows about 10 to 15 children per 1,000. But the research done by an organization in South Africa actually put it at about 28 to 1,000, which is quite a lot. The burdens by number, there are 17 million people live in cerebral palsy. Now, when you consider that there are parents, which is about 34 million. When you consider relations, when you consider doctors, nurses, caregivers, and so on, it's one hell of a number, about 350 million people. In Africa, we're talking about 2.6 million children living with CP. Each child, again, has, I think, hopefully 2 parents. Whether they're together or not is not the issue. But we talk of 5.4 million parents and maybe 55 million people who are closely affected. When we come to Nigeria, the numbers are a staggering 700,000 children with cerebral palsy, which gives you about 1.4 million parents and 14.8 million people who are closely affected by CP. And for Lagos State, it's 80,000 children with CP, 160,000 parents, and so on. I'm sure you'll be surprised when you hear these figures. Now, hey, Lagos, 160, yes. It's a percentage of the population of the area. While Lagos has close to 22 million people now, some states in Nigeria have less than 4 million people. So for them, the CP figures are going to be much lower. And then when you consider that 60 to 80% of these children have comorbidity. So it's not just that you have CP, but there are some other things like seizures, like intellectual disabilities and all that come with it there. So let's look at the picture here, starting from the one on the left. You know, CP can affect you differently. It can be on one side of the body, that is arm, leg, all the way down. It can be on the lower side of the body, where the upper part, including facial and all, is not affected. And it can be all over the body, where even the face is affected, speech is affected, mobility is affected, and so on. These pictures you see here show a whole bunch of kids, even to young adults, and you can see there that, yes, some of them can walk, but we have children or adults who can really not do anything for themselves. My son Laulu is 26, by the grace of God, just last week. He's fully dependent. He's nonverbal. So what does that mean? He wears diapers up till now. He's practically on the bed most of the time, even though we move him from the chair to the bed and so on and so forth, trying to do that almost every 2 hours to ensure that he doesn't have bed stores and any other things like that that stops him. Feeding is a problem, and medication too can be a problem. So he has a feeding tube through which we have unhindered access to give him his medication when it's due. What are the causes? Honestly, nobody can tell you exactly what happened, but many results from complications during pregnancy. And when I talk about complications here, it's because we live in a society where some people still have to do what they have to do, go to the market, maybe try to exercise, or maybe you have your in-laws saying that this lazy woman, get up and do something and all. And unfortunately, there are also cases of wife abuse, where there's a fight, there's trauma, or the woman just falls on her stomach. All these things can affect the brain. Then you also have the situation of an infant child who is born normal, but then he ends up with some complications along the line before it's age 5. You can see from this chart here that 75% of CP cases actually happen before the birth of the child. Another 5 to 15% happen during birth. Maybe the woman has complication, maybe she's not pushing well at labor, or maybe you have a situation where the umbilical cord ties around the neck of the child, and so on. And then you have the one that happens after birth, which again is between 10 to 20%. The early signs are quite simple. Straightforward. The child is stiff or floppy, is unable to do certain things, control the neck, is always crying, is always upset, and particularly when it comes to feeding, most of them cannot breastfeed. So if you don't notice that in time, it could lead to some other complications. Signs and symptoms are simply put together. The muscle tone, that means sometimes they're floppy, Sometimes they're stiff. It depends on what's happening. Movement coordination is very poor. Their reflexes are shaky and so on. So you reach out a ball or something, they want to grab it, but you see there is a problem between the eye and the hand, which should be automatic where the hand moves well. And they have problem with balance, whether they're standing or sitting. The fine motor function, that is like grabbing a small spoon, a pencil, and all those things, are virtually not there. Gross motor is the ability to stand, to walk, and all, they're not there. And oral motor is where it's not just about speaking, but at an early age, you see that they cannot supple, they cannot swallow saliva, and so they drool. Comorbidities where it is often accompanied by disturbances of sensation, cognition, communication, perception, behavior, or a seizure disorder. CP is reportedly the most common cause of motor deficiency in childhood. Now, when you talk about motor tone, we have what we call hypotonia, dystonia, mixed situations where 1 minute they are flexible, another minute they're having issues, and you also have fixed joints or where the hands are pretty stiff. The neck is a very simple, is a one that you notice very easily when they cannot hold their neck steady, and so on. Movement coordination, we have this, so we say there's spastic, you have attitoid kinetic movements, ataxic movements, mixed movements, and the ability to just gait, which is not able to stand and move as they should. Balance. They require both hands for support if they can stand at all. They have difficulty balancing when not using their hands. They're not able to sit without using hands for support. When they stand, they sway, they're unsteady, even when they're walking, and they have difficulty making quick movements. And where they can walk, you will notice that their movement is a little bit different from somebody who does not have CP. The gross motor functions, you have impaired capability of accomplishing common physical skills, such as crawling, walking, running, jumping, and maintaining balance. And you have delayed gross motor function where the skills, even if they come, will come at a much later stage in life compared to other children. Fine motor skills is when they cannot grab small objects, like I said. Holding an object like a pencil or a pen or a coloring pen between the thumb and the finger is just not possible. And setting objects down, if they hold something, there's an issue with the eye and the ability to control the hands, where objects may just drop a little bit higher than the platform, like a table. And most of them obviously cannot turn pages in a book. Oral motor function. When it comes to speaking, very few of them can really speak. And where they speak, they're not usually audible. It all has to do with, like I said, the tongue. The tongue is the one of the most powerful muscles we have in our body and one of the most active. And the saliva in the mouth is there to help moisten the mouth so that you don't get dry in the mouth. So that's why you notice that even you, listen to me, you swallow a lot. But if you cannot swallow, then what happens? The saliva still comes and it will drool off the side. If you cannot talk, if you cannot control your tongue, of course you cannot speak. And if you cannot swallow, you not swallow, you can't chew, and of course the drooling is there. Associated disabilities, you have issues like intellectual disability, seizure disorder, visual defects. A lot of CP children ultimately need glasses if they're able to see well at all. Hearing impairments, most of them don't hear well. Speech defect, which I mentioned, and cognitive dysfunction and behavioral problems. Of course, you can have some element of attention deficit hyperactivity because when They get excited. They can be so excited that you are even scared that don't know themselves. So CP can be classified in different ways. The most acceptable classifications are the international and the functional classifications. The international classification puts it in 4 categories, in which you have spastic CP, which is very common. You have a tetrad CP, you have tacit CP, and you have mixed CP, which is a display of all the 4 types of functions. The other one is the functional classification, where we say 1, 2, 3, 4, and there's even 5. Class 1 means they have no limitation at all. They can do virtually everything. Class 2 is slight to moderate limitation. Class 3, moderate to great limitation. And by class 4, they have no useful physical activity. Early intervention has helped many children with developmental disabilities to make drastic improvements and learn new ways of accomplishing tasks which previously challenged them. Part of what you need here is coordinated care, where, because of the complex nature of cerebral palsy, a team of specialists are required to work together under the coordination of a pediatrician for effective management. Now, what's the goal of treatment of cerebral palsy? Remember, I think I have not mentioned to you that cerebral palsy has no cure. There are lots of people who say, not yet, not this and all, but cerebral palsy was discovered over 80 years ago, 80 years ago. A lot of research has gone into it, and if, as of now, there's no cure, the chances are that we still have a long way to go to get a cure. But what has been proven beyond reasonable doubt, that management options exist that can make life better for the person who has cerebral palsy. So the goal of treatment is to optimize mobility, is to manage primary conditions that are visible, to control pain, to prevent and manage complications and associated conditions, and to maximize independence. You're also trying to enhance social and peer interactions, and you want to foster self-care when they can do some things by themselves, no matter how little. You want to maximize the learning potential, and ultimately you want to enhance the quality of life that they will live. So what's the treatment option? Like I said, a multidisciplinary team made up of physicians from various specialties, occupational and physical therapists, speech therapists, social workers, and counselors, particularly for the parents and, of course, for the children as they grow to become more mature, and special educators who handle them in schools. Then developmental and clinical psychologists. There's need to have somebody who can talk to the parents and who can talk to also the children to understand the journey and why things are not just working as advertised. That's why counseling is very important and needs to start as soon as the diagnosis is made. Family support is also crucial. Now we're talking about husband and wife. We're not just talking about husband and wife. We're talking about family, relations, friends who will help to stand by this family and encourage them to do what they're doing now. Prognosis. Long-term outcome depends on the severity of the motor disability and the presence and severity of cognitive functions. Other factors determine the prognosis, and they include other associated disabilities, level of motivation of the family, community, and social support, and the type and intensity of facilities available for rehabilitative intervention. CP usually affects several areas of function, and as a result, there is a requirement for many people, like I said. And it is best to have, but it is best to have a pediatrician coordinate the activities or the multidisciplinary care, because some of these people may not need to see the child not once a month or once every couple of months, but on a regular basis, the pediatrician needs to see the child and even to recommend or suggest other experts that need to look at the child. Is there any way to prevent CP? Say yes, but the truth is, just to have a well-supervised pregnancy and ensure safe delivery, appropriate investigations during pregnancy, early identification of high-risk pregnancies, well-trained birth attendants, efficient resuscitation of asphyxiated babies, good referral system, newborn examination and screening, good newborn care, including intensive care where necessary, prompt diagnosis and management of neuro like jaundice, and there's also issue of proper diagnosis of and treatment of meningitis. Other considerations will be developmental delay, physical disability, behavioral problems, developmental disability, and neurodevelopmental disability. Developmental disability is a constitutional delay in the child's ability to smile, to hold the next step, to sit without support, to crawl, and to walk. Physical disabilities range from a lot of things, and this is what you find that you have muscular dystrophies, where certain chromosomes are missing in the child. You have progressive muscle weakness, you have proliferation of connective tissue, which can stiffen and cause problem. You have intellectual disability, you have loss of ambulation at about 7 to 10 years. So your child may crawl, may do one or two things, but as they get to 6, 7 years, they start losing the ability to do those things. And by 10 years, they may not even be able to move again. Then you'll have contractures and scoliosis. These are when the muscles stiffen and they're unable to move or straighten their hands and their legs. And then scoliosis is when the spinal cord begins to curve, in a way that can be kind of difficult to understand. Behavioral issues. Many of them will have attention deficit disorder, that is, they're easily distracted, they'll have poor impulse control and decreased self-inhabiting capacity. Motor activity is a problem, academic achievement, or academic underdevelopment, poor interpersonal relationships with family members and their peers, and evidence suggests that genetic and environmental factors a significant role in the development of the child. Behavioral issues.
It does not necessarily.
Okay, let's get this right. Now we have developmental disability. And so it may surprise you that when your child has CP, what they have is not just CP. There could be other things. Children with CP, some of them will have signs of Down syndrome. A lot of them show signs of being autistic, Asperger's syndrome, and of course you have intellectual disability. Down syndrome, we know, is just the presence of 3 chromosomes, 21 instead of 2. It caused as a result of non-dysfunction in one parent, and incidence increases with increasing maternal age. So the older you are, the more likely you could have childhood complication. Autism is well talked about in Nigeria now, but the basic thing is that there's impaired social interaction, poor eye contact, the limited joint attention, and they have issues with verbal or nonverbal communication. Now, intellectual disability is a very interesting one I'd like to talk about. Intellectual capacity that is so impaired that there is need for special care or special education. The IQ test, an IQ test is used to determine if a child has intellectual disability. And I think we need to take note of this, because it's very disturbing now that a lot of children or young adults who are going to school, who are articulate, who are even recording very high performance in school, are classifying themselves as having intellectual disability. I think we need to get these young people to correct that. That intellectual disability means that you just can't cope in a normal environment. Now, with intellectual disability, it can be mild. It means they can function independently if well adjusted and can be educated, but most will require special education. Moderate is that trainable, can learn to read and write, but need close supervision. Severe, they may be able to protect themselves against physical danger, but they are not trainable. And the profound cases where they are unable to protect themselves, cannot speak more than a few words, and may require care similar to that of a baby, no matter how old they are. The way forward is to get diagnosis from appropriate professionals, get informed, separate fact, fiction, myths, get counseling, identify local intervention centers or options that are there, get involved or start a support group, determine severity, do needs assessment, determine clear indications and goals of alternative therapies, and learn to use play as a form of therapy. Let me go back to, the issue of doing a needs assessment. I'd like to plead with all of us here that one diagnosis is not enough to say this is the situation of your child. It is in your best interest to try and get 2-3 other doctors or facilities, teaching hospitals, federal medical centers, and all in the pediatrics department to look at your child and give you this, confirm this diagnosis of cerebral palsy, because we have seen too many children that are either autistic or there's an interesting one now that children much younger than 10 are beginning to have stroke. And once you have stroke, it means that you lose control of some of your one part of your body to some extent. But because the child has passed the age of 5 and has neck control and probably can speak, the child doesn't have CP. But many parents continue to classify them as having cerebral palsy. Coping tips. Every child is unique. Your child is your child. So love your child. Accept the child. Allow time for grief. There's nothing I can say to you that will say, okay, you will not feel bad. We're all expected to have a child that will do well, make us proud, and so on and so forth, and even take care of us in our old age. So when it is clear at the very early age that this is not possible, of course, we'll go through some, some issues, emotional and otherwise. But, talk about it. Don't bottle it up so that you can get people to encourage you and help you to cross that stage. Play with your child by getting down to his or her level. Every child can learn, no matter how basic it is, but we must come to their level. We must engage them and use whatever we can. It could even be body language, it could be sign language, to get us to communicate. And you will see that a lot of children with disabilities, not just CP, are in very foul mood. They cry, they get upset because they know what they want, but the caregiver or the parents can't seem to understand them. And so the only way you can do that is to make sure you spend time so that you can learn to learn. And when you have professionals working with your child, physiotherapists, speech therapists, occupational therapists, and so on, please spend time, pay attention, and learn what they're doing so that you can also implement some of these techniques at home. where you are with your child most of the time. Yeah, I also mentioned here that parents need care too. Because balancing your career, your family, and the needs of a child with special needs can be stressful. So maintain your friendships. So do that. Maintain your friendships and social activities. Plan fun activities with the whole family. Schedule time alone with your partner, your spouse, or a friend. Hire a caregiver or babysitter if you can afford it to give yourself a break. And read uplifting books written by other caregivers or parents with special needs. Finally, focus on the present instead of worrying about the future. I see a lot of people worrying, what will my child do? I hope my child will be able to do this and do that. The most important thing is now, live in the moment. Get information about what lies ahead so that we are prepared for it. But I can assure you that if you're doing the right thing, the worst case scenario that you are afraid of will not even happen because the child would have adjusted before leaving that area. So the way forward is to get counseling, build your own capacity about disability, join or help form support groups, become advocates and volunteers about your child's condition. Visit special homes or schools just to see other children and befriend someone living with a disability. If for some reason you don't know what to say, just say hello. Honestly, if you can even share that, oh, I also have a child with cerebral palsy or a child with disability, you'll see how this new person will suddenly become accommodating and come out to help you. We share that cerebral palsy has messy faces, some of which could be easily confused with other clinical conditions. It is neither infectious nor contagious. Like most developmental disabilities, cerebral palsy has no cure, but there are management options. Over 60% of children with cerebral palsy, including those that are nonverbal, have average to above average intelligence. And with early intervention and assistive technology, most of these children can learn new ways of accomplishing tasks that challenge them. For things to get better, the current mindset amongst the general Nigerian population about disability and disability management must change. And for that to happen, you, a parent of a special child, must be willing to come out and take every opportunity to tell your story, to share your experiences, and to learn from other people. I've learned in my life that the minute you start sharing your story, somebody else says, oh, me too. And then they tell their own story. And the more we share, the better everything becomes for us. So, in closing, I'd like to say that our children living with cerebral palsy are here for a purpose. Our jobs as parents is to help them find that purpose and thereafter nurture and celebrate that purpose. I'd also like to say that no two children with cerebral palsy look alike. Even if they have some signs and symptoms that are similar, if you look closely at them, you will see that yours has some either less or more complications than the other child. But as you begin to nurture them, as you begin to train them, you get the satisfaction of knowing that that child can do something. So thank you very much for your attention. I would like to take some questions from you.
Thank you very much. Thank you very much for that.